Yeah, students, today I'm going to explain my notes lecture 22. The topic is hemolytic anemia, also called as hereditary acquired anemia. So this is the type of anemia which take place because of the lysis of RBC, and there are many reasons. One of the reasons is also related with genes and hereditary. That's why this hemolytic anemia is also called as hereditary acquired anemia. Simple definition is it is the premature destruction of erythrocytes. Erythrocytes, that it is also called as RBC. So, if there is a premature destruction of RBC, then it leads to hemolytic anemia. Because we know that it is the bone marrow where this RBC synthesized, and after that it comes to the blood for the maturation. So before full maturation, if this RBC is going to destruct or going to break down, then it leads to hemolytic anemia. So hemolytic anemia will develop if bone marrow activity cannot compensate for the erythrocyte loss. Erythrocyte loss, we know that RBC after 120 days keep on breaking down in spleen and liver, and that has to be compensated by the bone marrow activity by the process erythropoiesis. So if this bone marrow erythropoiesis is not able to compensate this loss, then it can lead to hemolytic anemia. And we know that in the after 120 days of RBC, it goes to spleen, where there is a system called reticuloendothelial system, which cause lysis of worn or old RBC. The severity of anemia depends on whether the onset of hemolysis is gradual or abrupt, and on the extent of erythrocyte destruction. Mild hemolysis can be asymptomatic. There will be no symptoms for if there is a small scale blood RBC breakdown. While anemia in severe hemolysis can be life threatening and cause angina and cardiopulmonary decompensation. So, if you see the types of hemolytic anemia, it is basically two types: intracorpuscular and extracorpuscular. Means the reason of this breakdown of RBC lies within the RBC itself, whereas the reason for extracorpuscle is the reason lies outside the RBC. So intracorpuscular, that is within the red cell, we may have hereditary reasons or acquired reasons. In hereditary reasons, we may have the gene defects or hereditary related with the membrane defects. Then there may be some genetic defects of the enzymes where there is a lack of glucose 6-phosphate dehydrogenase. Then hemoglobin defects, hemoglobinopathies like sickle cell disorder, which I have already discussed, which is of various type: hemoglobin SS, hemoglobin CC, hemoglobin SC, and hemoglobin SB, as well as thalassemia. So sickle cell anemia and thalassemia is also a type of anemia which take place because of gene mutations, and that comes under hereditary. Whereas acquired reason for intracorpuscular hemolytic anemia, where it leads to membrane defects. The membrane of RBC got defects and cause breakdown. The best example is PNH. The PNH is the full form is paroxysmal nocturnal hemoglobinuria. Paroxysmal means episodic, episode. Nocturnal means night, and hemoglobinuria means the hemoglobin in urine. So this is a condition where what happened, RBC are having missing proteins that protects them from the body's immune systems. Generally RBC is having protein that protects them from the body's own immune system. But if this proteins is missing, then that condition is called as paroxysmal nocturnal hemoglobinuria, and that is the acquired. So the reasons of hemolytic anemia which lies within the RBC may be hereditary and acquired. Hereditary is again of three types. There may be membrane defects, enzyme defects, and hemoglobin defects. In membrane defects, there are certain conditions like hereditary spherocytosis. It is a condition where the RBC shapes become sphere like shapes, but we know that normal RBC shape is biconcave, which make it very flexible. But when it converts into a sphere shaped, then the membrane gets damaged. Then hereditary elliptocytosis, here the shape of RBC is getting converted into elliptical shape or ovoid shape, which can also cause damage of membrane. Then hereditary pyropocytosis. This is the condition where the RBC acquire different shapes. Because of that, also membrane can damage. And the next is hereditary stomatocytosis. Here the shape of RBC will become stomata-like, okay, where there will be a pore in the membrane of RBC like a stomatal pore, which leak out sodium and potassium and cause membrane defects. So these all are hereditary related. And there is enzymes called glucose 6 phosphate dehydrogenase. This enzymes is very important because it protects the damage and rupture of RBC membrane. So if there is any genetic defects of this enzyme, if anybody is not having the genes which code for this glucose 6 phosphate dehydrogenase, then obviously it causes RBC breakdown. Then hemoglobin defects, we have already discussed sickle cell disorder and thalassemia. Whereas the regions which lies outside the RBC is extracorpuscle outside the red cell, and it may be autoimmune or non-immune. The regions which lies outside the RBC may be related with autoimmune or non-immune. The things which is related with autoimmunes may contain warm antibody, cold antibody, transfusion reaction, and drug associated. Warm antibody is nothing but it is the autoantibodies that attach to and destroy RBC at a temperature equal to or greater than normal body temperature. Whereas cold antibody, it is the autoantibodies which cause RBC to clump together when person is exposed to cold temperature. Transfusion reaction, we know that when there is a wrong blood transfusions, then there is antigen antibody reaction, or also called as agglutinin reactions, which break down the RBC. Drug associated means there are certain drugs, if you take the drug molecules goes and bind on the RBC membrane and act as antigens against which antibody will be produced, and that antibody binds on this antigen and cause breakdown of RBC. So this warm antibody, cold antibody, transfusion reaction, and drug associated, these are the reasons related with autoimmune which cause the breakdown of RBC. Whereas non-immune related things, hypersplenism means in this condition the size of spleen is going to increase, and it is going to become overactive, and it is going to cause a lot of RBC destruction. Because we know that spleen is the place where after 120 days the RBC is taken and it is degraded. But when it become more hyperactive, then it causes more RBC destruction. Then infections like malaria, we know that in malaria that Plasmodium vivax, this mosquitoes, they cause they attack the RBC, they do their life cycle in RBC, and that cause the damage of RBC. And certain kind of mechanical trauma to RBC means any kind of physical damage to RBC. Then liver DZ, that is poor cell. It is a condition when there is abnormal function of liver, like alcoholic liver disease, where this cause damage to RBC. So this is the types: intracorpuscular, extracorpuscular. That is, region lies within the RBC, region lies outside the RBC. Region lies inside the RBC may be hereditary and acquired. Region lies outside the RBC can be autoimmune and non-immune, and the different types. Then we have etiology for this hemolytic anemia. In that, one etiology is intravenous immunoglobulin G therapy given during pregnancy. This is the therapy is given to the women which is having a lack of antibodies or immunoglobulin G, and which make them a little less immune system. So this immunoglobulin G is given, and the side effect of this therapy is that it causes hemolytic anemia. And then there are some contrast medium like iomepirol. This is the iodine contained fluids which is used for some imaging purpose. So this contrast medium fluid also binds to RBC and cause their hemolysis. And then next, mitral valve replacement. Sometime what happen, the bicuspid valve, also called as mitral valves, which lies on the left side, when this gets damaged or not functioning properly, then artificial valve is placed. So that valves also because keeps on coming in RBC and they cause damage. So etiology is, one is the intravenous immunoglobulin therapy, second is contrast medium iomepirol, and third is mitral valve replacement. This cause hemolysis. Whereas some hereditary disorders which cause hemolysis as a result of erythrocyte membrane abnormalities, some enzymatic defects, and hemoglobin abnormalities. This can also cause hemolysis. If you talk about hereditary disorders, then this includes the lack of glucose 6-phosphate dehydrogenase deficiency. This is the enzymes which actually protect RBC from being damaged and premature destruction. So if there is any genetic defect of this enzyme, then you cannot prevent RBC getting damaged. And hereditary spherocytosis, where the size of RBC is becoming sphere shapes, and any further increase in the size can lead to the membrane damage and leads to hemolysis. Sickle cell anemia also, where the size of RBC become sickle shaped, which is very unstable, which can damage because that flexibility is maintained in RBC because of its biconcave disc structure. So any deviation from that structure make it non-flexible and can lead to the membrane damage. There are some acquired causes of hemolysis which includes immune disorders. Okay, there is some immune problems, then your immune system can identify your own RBC as a foreign and cause its hemolysis. Some toxic chemical and drugs, some antiviral agents like ribavirin, some physical damage, and then some infections. So these are the some etiology. There are reasons which can lead to hemolysis. Autoimmune hemolytic anemia can be due to warm or cold autoantibody types and rarely mixed types. So autoimmune means your own immune system is going to attack your own body cell. Here especially attacking on RBC, that's why it is called as autoimmune hemolytic anemia. And it can be due to warm or cold and autoantibody What is warm or cold autoantibodies? If that autoantibody is acting on the temperature above your body temperature, then that autoantibody is called as warm autoantibody. And if it is acting below the body temperature, that is called as cold autoantibodies. And most warm autoantibodies belongs to the immunoglobulin IgG class. So these are some etiology reasons. These are the actually reasons which are because of that hemolysis, that is breakdown, premature breakdown of RBC take place. Symptoms wise, the first is paleness of the skin, that is the lightness of the skin color, and due to decreased RBC or blood supply, because there is destruction of RBC, and number of RBC is going to decrease. So normal color skin will become light, that is paleness of the skin. Then fatigue, that is tiredness or lack of energy. Then you'll have a fever, confusion, lightheadedness, dizziness, that is feeling of faint, weak or unsteady. There will be weakness or inability to do physical activity. So these are the symptoms of hemolytic anemia. So after definition, after types, etiology and symptoms, we always discuss about the pathogenesis. And pathogenesis, we always try to deal with some flow chart or diagram that makes the contents easy to remember. Otherwise this for 5 marks it become very big if you keep on writing its definition, its types, its etiology, its symptom. So after writing this for 5 marks, if you draw for pathogenesis the flow charts, so that will be enough. So in pathogenesis, of hemolytic anemia, if you draw this diagram, then it's sufficient. So this pathogenesis means the breakdown of RBC is going to take place. If it take place inside the blood vessel, then it is called as intravascular hemolysis. But if take place outside the blood vessel, now what are the places outside the blood vessel where blood lysis can take place? So that is called as extravascular hemolysis, and the places may be spleen and liver. Spleen and liver, they have reticuloendothelial systems which cause this hemolysis and remove the RBC, old RBC. So this diagram we have to understand for pathogenesis. This is the one which is justifying for extravascular hemolysis, which start from step 1, that is antibody coated or irregular RBC. When your RBC is of irregular shape, it is like a sickle shape, or when your RBC is coated with some antibody. Okay, so when your RBC is coated with antibody, or when it is irregular shape, then this helps the macrophage to do phagocytosis. So this kind of RBC goes for phagocytosis, where macrophage will come and it will bind this RBC, and it will be taken inside, and degradation it will in lysosomes. So when this RBC is coming inside through the process phagocytosis, then this RBC will mixed with lysosomal component, and it will be degraded, and the content will be outside, like intracellular hemoglobin will be released, and this will become out as a biliverdin, and this biliverdin will go to liver, where it will be converted into bilirubin, and then it will be go for biliary clearance. So like that, this extravascular hemolysis, that is the breakdown of RBC outside the blood vessel, especially in spleen and liver, take place because spleen consists of radiculoendothelial system, which consists of cells like macrophage and monocytes. These are the cell which present in reticuloendothelial cells, which destroy the RBC, and it happens in when there's it happens by the process called phagocytosis. Macrophage take this RBC inside it, then lysosomal content will be mixed with this RBC, and the content of RBC will be released. That is intracellular hemoglobin. Then this will be released as biliverdin. This biliverdin will travel to liver. Liver will process it and convert into bilirubin, and then it goes for biliary clearance. So this is the extravascular hemolysis. Now intravascular hemolysis, that is the breakdown of RBC inside the blood vessel itself. So this is the wall of blood vessels. These are the epithelial endothelial cells. So RBC in circulation is going to go for direct lysis. That can happen because of shear stress, because of toxins, and because of complement. Then it leads to intravascular free hemoglobin release. Because the lysis is done, hemoglobin will release. Then this hemoglobin will be captured by haptoglobin. This haptoglobin will bind to this free hemoglobin, and it goes for hepatic clearance. But if heptoglobin capacity exceeded, then it can also excrete it through kidney. That is renal tubular excretion, that is called as hemoglobin urea. So pathogenesis of hemolytic anemia is generally explained in the form of two diagrams. One is explaining the one intravascular hemolysis, another is extravascular hemolysis. Intravascular hemolysis is taking place inside the blood vessel, where there is a breakage of RBC because of shear stress, toxin, and complements, which cause the release of free hemoglobin. This free hemoglobin is captured by haptoglobulin and taken to the liver for hepatic clearance. But if there is more hemoglobin release, then of course the haptoglobin cannot capture every hemoglobin. For that, some hemoglobin starts coming out through kidney, that is hemoglobin urea. So this is the hemolytic anemia. So in this hemolytic anemia, for 5 marks, you have to mainly remember the definitions, types, etiology, that is the cause, fourth symptoms, and fifth is pathogenesis. So definition, 1-2 lines you can write. Types, you have to write the different types, etiology, and symptoms, then pathogenesis. The contents will be enough for 5 marks. Thank you.